So in the next episode, or I should say I'm going to share a video, and it's an interview with Dr. Lee Stickles, a very, very special man and friend to me. And I started seeing him when I was 9 years old, and I actually continued seeing him to age 25, which is probably unheard of. But at age 25, I got pregnant, and he called me on the phone and he said, Andrea, I guess it's time. It's time for me that I have to let you go. And it was so kind in how he delivered that. He was a smart, kind, and he loved being a pediatrician. He saw me in the good times and as well as some really difficult circumstances in my life. He always had an open line when Mom needed advice. She would call, and he always could call her back that same day. And he guided Mom along the way as I was a child with diabetes. He passed away on July 27, 2022. And I'm so thankful that I was able to spend time in his living room, talking to him, letting him share about where diabetes has come. He lived till, I believe he was 95 when he passed away. And another important thing that he did is he gave the toast to the bride at my wedding. And that was a special day. So I just want you to listen to him talk, because he loves to share about diabetes. And he really had a big clientele. Like, his patients came from, he said he had them all over the place. And diabetes was such a specialty to him. So stay tuned and listen to this episode. So I wanted to introduce Dr. Stickles. He's been my pediatrician since I was about 9 years old. And he's from the Fredericton area. So I wanted to have him as a part of my YouTube video because he's been such an important part of my life. So Dr. Stickles, just tell me when did you become a pediatrician?
In 1959.
Okay. And is that, like, were you a general, like a doctor first? Like, I know you had to become a doctor.
Yeah, I graduated from medical school I finished medical school in 1954.
Okay.
Then I interned in 1955. And then I did my residency training.
Okay. So did you always know that you wanted to be a pediatrician?
No.
Or
No.
what changed your mind?
Well, I never thought of pediatrics as a medical student. But when I was interning, I happened to get involved with a lot of interesting pediatric cases and decided that's what I'd like to do.
You had a few more years then.
So then I set up my residency program, but I did my first year in internal medicine.
Okay.
Back then, there were two qualifications you could get. One is certified in your specialty, which most people got, or you could get a fellowship in your specialty.
Okay.
And if you wanted to do the fellowship examinations, you had to have at least 6 months of internal medicine or pathology. So I did a year of internal medicine, but I got to like it so well, then I just didn't know if I wanted to go on into pediatrics. But so it set up some confusion, but anyway, I had my whole program all set up, and so I followed up and went into pediatrics.
And away you went with it.
Yeah.
And so when did you you kind of retired, but you did some special cases too, didn't you? Still in Fredericton.
You mean?
Did you work on some special cases and then kind of ease back in your workload?
Yeah, I did general pediatrics for most of my career. Then the last few years, I retired when I was 84. The last few years, I got involved with a lot of behavioral pediatrics, which was an unmet need, and it's very time-consuming and
it's kind of a change.
Not very profitable.
Yeah, I'm sure there's a lot of responsibility.
Yeah, but so I did mostly that the last few years that I practiced.
Well, as you know, I came to you when I was approximately 9, and Mom is always the type of person, and you know my mom, you remember her well.
I remember her well.
And she just wanted to have the best, in that you were going to give her encouragement, and that's something that she didn't have in that day. That's been, as you know, I mean, I'm 50, and I was 9 months old.
Yeah.
So you've seen, a lot of changes there. But what she had heard that you were such a wonderful doctor, and she knew you were encouraging.
It was just a rumor.
Well, I beg to differ on that one. So you saw diabetes a lot like what I did back. I was on beef and pork insulin, and I've gone through a lot of changes in the diabetic era. And you have too. I mean, you've seen a lot.
Absolutely.
So were diabetics something that you treated a lot back then, or did you find over the years you seem to get more cases?
Well, as a pediatrician in a place like Fredericton, you, although at least in the first several years of practice, you did some primary care pediatrics, but you still looked after the chronic health problems, kids with more important chronic health problems that made up a lot of your practice, and would see like diabetic and look after diabetic kids from not just in Fredericton, from around the whole area. So I had a lot of diabetic patients.
Did you have many young children? Like I was 9 months old, right? And there was 3 of us in New Brunswick when I was diagnosed under the age of 1. And I was one of those. So did you have young children, or like as in that young?
I didn't have any infants. We had one family with 2 infants here, 2 children who who were diagnosed with diabetes as infants. And interestingly, one of them is married to one of our anesthetists.
Oh, really?
Yeah.
Okay.
And
I wonder if that's the couple. Has that been a while ago? Was that a while ago that they developed diabetes?
oh, yeah.
Was it the Ferrises?
Yes.
Yes.
Yes, many years ago.
Yeah, Mom and her used to talk back and forth. Yeah, I remember
Yeah,
that.
they lived in Marysville.
Yeah.
Yeah, the Ferrises.
That's Mom. Actually, she wondered what
I
they were
asked
doing.
Dr. Hamilton how she was doing. 'Cause I didn't know that's who he was married to.
Yeah.
And I was talking to him in the surgeon's lounge one day, and he mentioned that. So I was, of course, very interested in how she was doing. But he said she's doing very well.
That's really good, because those 2 and me were the ones who developed it.
Yeah, as
in New
infants.
Brunswick. Yeah.
Which is very uncommon.
That makes me. That's emotional.
Yeah.
Wow. And I know you've seen many changes through the years with diabetes. And is there one thing that kind of stands out in your mind that was a good change?
Well, they all were good changes. The like when you were first diagnosed, it was the way of monitoring diabetes was very crude.
Mm-hmm.
I mean, we always had, you could go to the hospital and get your blood sugar taken, but that just gives you one moment in time.
Yeah.
And you could always check your urine for sugar and acetone, but that doesn't give you a lot of information.
Mm-hmm.
And then over the years, there's just been one thing after another that's come along.
Mm-hmm.
The next thing, if I remember, came along was the 24-hour fractionated urine glucose.
Mm-hmm.
And that made it like we could collect a urine for 12 hours through the day and 12 hours through the night, and calculate the sugar,
Yeah.
and that'd give you a rough estimate of your diabetic control.
Yeah.
And then the hemoglobin, glycosylated hemoglobin A1C came along, and that gave you a nice picture of their diabetes over up to 3 months.
Yeah.
And
That was encouraging.
But by far the biggest, what I still think was the biggest advance in the care of diabetics was the glucometers.
Mm-hmm.
The original one was the glucometer, where you could home monitor blood sugar multiple times a day or in any situation. And I think that even today, that's the last thing you'd probably would want to be without.
That's right. That's right.
And then, of course, we got new insulins and multiple dose insulins a day instead of having fixed doses in the morning. And new insulins, a lot of new insulins. And changes in the way we looked at diets, carbohydrate counting, and that sort of thing. And then now the team approach to management of diabetes, and with multiple professionals being involved in the care. And but if I had to pick one thing, I would pick the glucometer.
It's true, though. I agree with
And
you.
what could you do without the glucometer?
Because I was 16.
Oh, we forgot about the pumps.
The pumps, yeah.
Pumps, the insulin pumps, and how they've come along, and the technology that keeps developing is absolutely amazing.
It is, and it's exciting.
Yeah.
Because when you come from here and then you go through and you see through all the stages, it's pretty amazing.
But I would still pick the
Glucometer.
It's the number one.
Well, I just did my blood sugar before I came in because I was a little nervous. So it was 5.4, so I was like, yes.
Perfect.
And my hemoglobin A1C, my last one, was 5.4. So that's pretty good, isn't it?
Yeah, we aim for less than 7, but not many people make less than 7.
No. And I guess that's to my goal.
They have the potential to make less than 7.
They do, yeah.
But it takes so much effort.
Yeah, it does. I do want to tell you, I'll tell you what I remember when I came to see you, okay? So when I would come into your office, I knew what to expect because you were very involved in looking at my chart, any blood work, any conversations that maybe you and Mom had had over the time. I knew to sit there because you were observant. You'd look at me and you'd look down at your notes. And then I'd get up on the examining table and you'd check me all over and then we could talk. That's just how you were. You were so pertinent.
Sounds like I was regimented.
No, but I knew because you were a deep thinker. You were very detailed. And before you gave me, and I get all emotional. Before you gave me any changes that you wanted me to do in my regime, you thought it out very carefully.
Well, I think a doctor should know everything about the patient when you're seeing them. often I would do that ahead of time, but when you had too many, you couldn't always do it. But you should know all the details about the patient when you're seeing them.
Yeah.
So
But I always knew your way, and I always respected it. And just remember, because then I could have talk to you and things like that. So I just thought, you taught Mom and I to how to handle my diabetes. You showed us, and that carried on from Mom to me, and then I took over the control.
Yeah.
And that's the key, isn't it? For a doctor to teach the parent or the child how to make those changes.
Well, when you're dealing with a chronic illness, ideally the patient or parents should know as much as the doctor does about the illness that they're dealing with.
Makes a big difference.
If they're not well informed, they're not going to be doing their share of
the care, right?
Of the health care.
So, in your opinion, and just be honest, and you know this, diabetes isn't an easy disease to control, but it is possible. But it does come with, if your blood sugars aren't in good control and they're up, it affects our emotions. It affects how we handle life. So it's not always easy. But there's been so many changes in insulin delivery and managing it over the years that's pretty. We do have more to work with than what we did years ago.
Absolutely.
So we can lead
That's the
normal
understatement.
lives. So I can lead a normal life. I actually do a lot more than what some other people have done in their lives because, I have taken good care of myself. Do you want to add anything more to that, or?
Well, dealing primarily with children, it's very important to keep them in good control because you have a lot of things to consider. You have their growth and their weight gain and thriving and growing. If they're not well controlled, you delay their growth. And if you have too many periods of hyperglycemia, high blood sugars, or too many low blood sugars, you're on a risk of affecting their brain development. And if they're not well controlled, you're going to delay their puberty, and there's so many aspects involved in the care of a diabetic child as opposed to an adult. But it is certainly a challenging disease, and it's not easy. I always felt bad when I had a new diabetic because I knew the
road ahead.
I mean, it's a very treatable disease, but it's not something you'd wish on somebody.
No.
It's a lot of effort to reach the maximum care, and it's constant. It's constant.
Can't just take a break, can we?
No, it's every day, every minute, every hour type of disease.
It is, isn't it? And you know the struggles that I went through. We don't have to go into detail, but you were there with me, and it wasn't always easy. There was I remember you said at the toast to the bride that you gave when we got married, you said there were some good times and not so good, and then the good times came again. So you saw me kind of a little bit low, but then you saw me fly too.
Yeah.
And
that's always going through adolescence. It's you almost anticipate you're going to have some rough stretches. If you don't, you sometimes wonder why you didn't.
Yeah, because I went through them a little bit later, and that's to encourage diabetics too. Is there is a lot of pressure put on us in the sense that if you have good control, then that's good. If you don't, if you kind of fall off the wagon a little bit, you get frustrated. But I don't want people to get frustrated with that. I want them to see that, you just got to take it a step at a time.
Yeah.
And, you got to have fun. You got to enjoy life, but you do need a good team behind you, like what you said.
Yes. Oh, you can live a perfectly normal life. And now, the way diabetes is managed, most diabetics should be able to look forward to a pretty well normal life expectancy.
Yeah.
Certainly that wasn't the case when I first started.
No. Because I think too is a lot of the negative, like the side effects that can happen with poor control were really in Mom's face a lot. And she understood that, but she wanted to be someone who, wanted more encouragement. And you gave that to her, and you gave that to me.
Yeah.
So, I really appreciate you taking time today, because it's pretty special. This is a highlight of my life. It really is, just to be able to, And then I remember, I called you. Doug and I had gotten married, and then 3 months later, I got pregnant. So I called you and I said, I'm pregnant, and you had to say goodbye because you were a pediatrician, and I had to move on. And I'll never
when
forget
husbands
that.
start calling me, I say, when husbands start calling me about their wives, I say, it's time the wife found a new doctor.
And that
Or
was
the
how-
wife called me about
that they were
about the husband. I say, I was always comfortable looking after older kids and young adults because of my year of internal medicine. It gave me a good step up on that.
So do you miss it? Do you miss still going to the hospital, or you?
I did
you
it first,
Mm-hmm.
and now the thing that I miss the most is the kids,
Yeah.
the teenagers,
Mm.
dealing with them.
That's pretty special. Well, I want to give you a hug and get this on here.
Good.
I just think you're wonderful.
I really hope you enjoyed listening to Dr. Stickles. Just as he talked, you could just see so much passion in his voice. And just at the end of the video, he gave me a hug, and that was pretty special. I just hope that you've learned something through that. Maybe you saw how we used to use, we had to test our urine to find out what the blood sugar was. And how he said one of the most amazing things is when the glucometer came. I never got my first glucometer till I was 16. So, and he talked about the hemoglobin A1C, and there's so many things. Even since his era, there's been a lot of changes, but I trust that there's something in there, because I know a lot of people, a lot of you who are listening would know Dr. Stickles. So please stay tuned as you hear about my mom and dad.